Today, I want to talk to you about trauma, mental health, and addiction. To this day, in my clinical practice, I still work in treatment centers. It's not uncommon to deal with individuals and to work with individuals who have experienced and still deal with the pain of past traumatic events, mental health diagnosis, and addictive behavior. You'll find that these three tend to live very closely one with another. And so, in your work as a biblical counselor, you're going to meet individuals who are dealing with the effects of past traumatic events. It manifests itself many times in what we would call clinically a mental health diagnosis or mental health concerns such as depression, anxiety, bipolar disorder, personality disorders, all kinds of things fall into this category. And because of that, these individuals are very susceptible to addictive behavior. And so many times, though you may not be in a clinical setting, individuals in your counseling office will tell stories of how they have gone through traumatic events. They're dealing with the pain. They also present and express mental unwellness, and they will talk to you about addictive behavior. For some of those folks who are currently in the throes of addictive behavior or paralyzing mental health diagnosis and presenting problems that go along with that, there may be the need to bring clinical supports in or to refer out. We can talk about that specifically in our one-on-one sessions and our mentoring and supervision of the program. In this video, we're going to talk about how that all sits together. There are others who are in the healing process and they're going through that, but that has been a part of their life. It's been a part of their history, and it's part of their life in such a way today in the present where they must find a way to manage and to navigate through past trauma, current mental unrest, and also addictive behavior or the tendency to fall back and relapse into addictive patterns. And so, what we'll deal with in this particular video also is how your faith and how your practice as a biblical counselor can help individuals who are struggling with their traumatic events of the past, mental health presentation, and the addictive behavior. So, we're going to talk about healing and hope, and we're going to talk about deliverance and breakthrough in these particular patterns. But before we get there, we have to understand and we have to unpack why these things connect, how they are connected, and how we resolve them through the grace and the power of God in our lives. I want to begin by talking to you about a couple of words that we often use. One is to restore. It's important that we understand the meaning of these words. We use these words all of the time. Restore, healing. What does it mean to restore? It has the idea, the actual word has the idea to mend that which was broken. And it has the idea of setting a bone back in place after it has been damaged, after it has been broken. And that healing, that restorative process takes time. Now, if you were to break your leg or to break your arm, I hope that you don't, but let's say that you did, you would need some help. Somebody would have to help reset that bone. And from that point, there would be a cast that would be applied, and healing would take place in time. And in time, you can be stronger in the broken place. In time, you can get back to full capacity. In time, through therapy, through help, through a great deal of commitment, you can get back to where you were, but there is a process. Athletes who play on the field will tell you that the injury is not as painful as the recovery. But the more that they are committed to their recovery, the stronger they get, the faster they get back on the field. And so the injury is pretty bad, but the recovery, that process, can be very uncomfortable, but it can yield incredible results. And so when we're working with individuals through their recovery from addictive behavior, recovery from past trauma, recovery from mental unwellness, yes, it takes time. We need help, and there is a process. And sometimes in the process, an individual can grow weary, can get discouraged, but you have to trust the process because God is in the process. Another word I think that is very important for us to understand is this word of recovery itself. Recovery has the idea of restoration to a former or better condition. Restoration to a former or better condition. In this idea of recovery, in this idea of healing, I believe this. I believe that God can take you to a place that's even better than you were before. I believe it's more than just a reset. I believe that God can use the past pain in our life to effectively make us a greater servant of His, to do incredible things through our life. And so God is healing, God is restoring, and He's doing more than just simply a reset. He's taking you to a better place where you can be stronger in the broken place and through the trauma, through the difficulty, yes, even through the addictive behavior, and through all of it, there is the powerful restorative purposes and plan of God in our lives to be better. And that's what the grace of God is all about. Let's go a bit deeper into the discussion. I want to talk to you about brain chemistry and our psychological understanding. In the last 100 years, we've learned so much more about brain functioning, what the brain does, how it impacts the whole of our life, not only physically, but emotionally, and I would add spiritually, because you are a whole person. You are body, soul, and spirit. The Bible tells us that we are fearfully and wonderfully made. So I believe that it's important to understand brain function. And I think as we go into this subject area, I think it's going to be important for you to understand how it connects to trauma, mental health, and yes, addictive behavior. Over the recent years of medical advancement, we've learned so much about the brain and how it functions through the neurosciences, surgical procedures, brain scanning, imagery. We have learned a lot about the brain. Where did all of that begin? It began by the study of a man by the name of Phineas Gage. Phineas lived in the 1800s. He was a railroad worker up in the mountains of Vermont. Everybody who knew Phineas Gage knew him to be an upright young man. He was well respected. He was hardworking. He was polite and kind. And his job with the railroad, as they were blasting through the mountainous areas in Vermont, his job entailed placing the dynamite packs. And what he would do, he would take a tamping rod, which was a long steel rod, and he would take that rod and he would tamp it down, identifying the strategic placement of dynamite. And unfortunately, what happened? One day there was an awful accident, an explosion took place, and the rod, the tamping rod, blew up as he was tamping it down, and it went through his skull. Now, this was a tragic accident, but it went through his brain where it did not impact his motor skills, his ability to speak, but because it did go through and pierce the prefrontal cortex, it greatly impacted his emotional well being. And you can read about this story throughout history. You can actually go to Cambridge, to Harvard University in the medical school, and you can actually see the skull. And so, what happened? The explosion takes place, the rod impales Phineas right through his head, but he's able actually to walk to their clinic. And what happened was the very first brain surgery in America is recorded. The rod is removed, and Phineas, he heals from that traumatic event miraculously. And everything is has been studied about this case for many years. Now, the interesting thing, or what we began to learn about this procedure and about his experience, was that yes, he could walk, he could use all of his capacities physically, but Phineas changed emotionally. He was no longer kind. He was no longer gentle. And so the story goes, he was so dreadfully impacted that he was foul mouthed. He was belligerent. He was combative. He had all kinds of addictive behavior that came out of this event, and he died relatively young. And so, from his story and from his life, began this journey of the medical sciences to really understand brain functioning. And what we've learned is that different parts of our brain do different things. Different hemispheres and regions within our brain have an impact on us physically and emotionally. And so we've learned a lot about this. And so I use the story of Phineas Gage just to give you this understanding that the process of learning about brain chemistry and brain functionality has been going on for a long time. Our brains are very vital to our emotional well being as well as our physical well being. Let me take you a bit further in our conversation with regards to the brain and the brain functioning, brain chemistry. If you were to go online and do a deeper study of brain functioning, you'll find that the medical sciences separate three parts of our brain. They refer to the brain as the triune brain. So, what does medical science say about our brains? Medical science tells us that there are three distinct operating parts of your brain. They talk about the human system, the mammal system, and the reptilian system. Now, being a man of faith and a man of the word, I absolutely object to those titles. And so, what I'm going to do for the sake of our talk is I'm going to recognize the functioning areas of our brain, but I'm going to relabel them. And so in your brain, this triune brain, you have a thinking part, you have a feeling part, and you have a reactive part. I want you to consider this with me. There are three parts of your brain. You are the imago Dei, the image bearer of God. You are created in the very image of the triune God. And so, as God is Father, Son, and Spirit, so are you, body, soul, and spirit. And God has created your brain into three separate parts that are one. And if you study anatomy, you'll find that God has placed his fingerprint on the whole of creation. There are three parts of your eye, three parts of your ear. There are three parts of a cell. So, down to the cellular level, God has placed his fingerprint upon his creation. So, what does all of that mean? I'm going to use my hand as a model of the brain. And so imagine with me that this is your brain. What you have here, this is what I call, by the way, my handy model of the brain. What you have here is the prefrontal cortex. The prefrontal cortex is the place of executive functioning. It's where you're creative, it's where you problem solve, it's discernment, it's judgment, all of those things that make you an advanced human being separated from the animal kingdom exist right up here. It's the most complex area of your brain. But beneath the prefrontal cortex, or the thinking system of your brain, is the feeling system of your brain. And in that feeling system, that is where the amygdala is, that is where you have all of your emotions, your memories are stored in that inner part of your brain. And so that is where you feel deeply. And so you have the thinking part of your brain. Down deeper, you have this system, this limbic system that is the feeling part of your brain. And then the very base of your brain, this part back here, that is the reactive part of your brain. So right now, you're calm, at least I hope you are, and you're listening to this video, and maybe you're even taking notes, and you are completely residing in the prefrontal cortex, in the thinking part of your brain. But what happens when you are uh, aroused, reacted, when you feel or sense the presence of danger? You will go from the thinking part of your brain to the emotional feeling part of your brain to the reactive part of your brain very, very quickly. And so what happens, you go from here, and it's almost, yes, as if you flip your lid, and now you're feeling and you are reacting. God has made the brain to work this way. In the presence of perceived danger, if a car pulls out in front of you as you're driving along the highway, you go from thinking to reacting. You hit the brakes, you swerve immediately. It's built in you to do that. What also happens when you are confronted or when you go through a traumatic event, you go to those areas as well. Trauma impacts us emotionally. It impacts that reactive pattern. What we refer to this in a clinical sense, and you're probably very familiar with these terms, it would be the fight, flight, or freeze response. And so, as soon as I perceive danger or I am in a traumatic situation, the brain functions differently, and I go to feeling and I go to reacting very quickly. Now, in traumatic events in my life, what happens? Those events are stored in the amygdala. They are stored down deep in the brain. I feel about those events very deeply. And when I am quote unquote triggered, when I sense that same sense of threat or harm, I go right into that reactive state. As a matter of fact, once your heart rate gets over 100 beats per minute, you're in a reactive state. And that plays out in all kinds of things, especially our relationships. If you and your spouse or significant other are having a disagreement and you become flooded with emotions, what happens? You're no longer thinking with the thinking part of your brain. You're no longer operating in the prefrontal cortex. You become emotional, you become reactive, and nothing productive is happening. So when you learn to self soothe, you can get back to that spot of calm, back to that place of calm. And now you're thinking in the executive area of your brain. You're creative, you're problem solving, you can compromise, you can do all of those types of things when you are not emotionally charged. What we know about brain chemistry is this, is that trauma impacts that greatly. And addictive behavior tends to come out in our life and becomes invited into our life as we learn to cope in an unhealthy way to the feelings, to the active nature, to the pain of events in our life. And so this is yet but a overview and a glimpse of what's happening inside a person's brain when we experience traumatic, difficult, and painful events. As you consider brain functioning, you must also consider brain chemistry. So we know that when we are stressed, when we experience trauma, what happens? We go from the executive thinking part of our brain, the executive functioning, the thinking part of our brain, to the emotional reactive part of our brain instantaneously. Sometimes we will say about a person, it seems like they went from 0 to 100 in 6 seconds. Well, they did. Why was that though? Because the chemistry makeup of your body is such that when you perceive threat, when you are stressed, when you are confronted with something, that the stress hormones are released in your body. Stress hormones are cortisol and adrenaline primarily. And what happens is that comes into your body, it goes through your brain, and now you are reactive, you are emotional because you are so stressed. Post-traumatic stress disorder is a stress disorder. So when we are stressed, when we experience trauma, those those stress hormones are released. But let me take you to the addictive side of this. In our bodies, in the chemistry of our body, we have a specific neurotransmitter, that of dopamine, which is sometimes referred to as the feel-good hormone. It's also at work. And so if somebody comes up to you, an old friend, somebody that you admire, and they give you a big hug, what's going to happen? You're going to get a rush of dopamine, and that feels good. You can feel it emotionally. If you get good news, if you have some comfort food, it's a boost of dopamine, that neurotransmitter that just makes you feel really good. What happens in addictive behavior? Many times, because we're dealing with the stress of trauma, dealing with past memories that are held very tightly down deep in the amygdala. We cope. We cope with substances. We cope with all types of addictive behavior to numb the pain, to soothe the pain. The problem with that, when someone goes to an opioid, some sort of substance, alcohol, they get an a natural high of dopamine. And that dopamine is at a much higher than natural dopamine production. And so what happens, it changes the chemistry of the brain. And in order to feel good, in order to get to that level again, you go right to the same substance of choice. And not only does the dopamine have the property of making you feel better, but it also has the ability to make you feel less pain. And so opioids are a drug of choice. And in our culture, we have an opioid crisis right now. And with fentanyl, the synthetic version of opioid, it is resulting in massive overdoses and deaths, and it is a ill upon our society. But what that does is it affects the brain chemistry. And what's really sad about this is now that things that made us feel good before lose interest. You don't quite find seeing the old friend or having the warm meal. It doesn't satisfy the same, and so you go to that drug of choice. And so addictive behavior, because of that, has been identified by the medical community as a disease. And so that's where that language comes from because they see that the chemistry of the brain is greatly altered. Now, I will tell you this, that it is an alteration of chemistry within our brains, within our bodies. But the body does have this wonderful ability to recover and to restore. It's the nature, the way that God has made us. Does it take time? Absolutely. Is it a process? Yes. Is the process uncomfortable all of the time? But the results are profound for those who go through and are committed to their recovery. The results are seen so often. And in my clinical work, I have had the privilege to see powerful recovery. And yes, there are stories of relapse and failure as well. And so often we see that the individual journey is a part of that up and down experience in your counseling sessions. You will have these stories as well. And what I would admonish you to do is to be strong in faith and be faithful in prayer and support for the individual, recognizing when they need clinical support in addition to counseling, especially if there's a significant relapse. So, here is just but an overview of brain chemistry and brain functioning. I'll leave you with this hope. Our God is a healing God. He is a restoring, redemptive God. And God's grace is sufficient for your time of need. God's grace is sufficient for the need of the individuals that you work with. It's not uncommon to work with somebody in a biblical counseling scenario that is post treatment. That means that they've come out of rehab. Now you're working with them and helping them on the journey of recovery. And that's a wonderful journey to take. Others may be post treatment, or maybe they've gone through treatment before. Nothing has worked, nothing has stuck. And my encouragement to you is to keep working with this individual because God is such a God that he can bring the breakthrough, bring the deliverance at any time in a person's life. Many times, what they need is the right person to come alongside and to help. So, in working with individuals through trauma, mental unwellness, and addiction, they will be some of your greatest victories, and you will experience some heartbreak along the way because that's the nature of life. In the healing part of this, there is so much hope. Let me take you to a verse, Romans chapter 12 and verse 2. Do not conform to the pattern of this world, but be transformed by the renewing of your mind. Then you will be able to test and approve what God's will is, his good, pleasing, and perfect will. The Bible tells us that our minds, our brains can be renewed. No matter what has happened, no matter what we've gone through, and a person may have gone through traumatic events, significant um, addiction, all kinds of things. But that is a mind, if given and yielded to the Lord, that can be renewed. And so be strong, be wise, be informed, be educated, invite support in when needed, but our minds can be wonderfully and beautifully renewed and restored. God doesn't just say, take the mind and throw it away. It's not good. No, he says, let's renew our minds. Let us embrace and have and receive the mind of Christ.